Hello and welcome. Let's talk about antipsychotic drugs. So, now classification of antipsychotic drugs. It may be typical or traditional or first generation drugs like phenothiazine derivatives, which includes chlorpromazine, thioridazone, mesoridazone, trifluoroperazine, or thioxyxanine, butyrophenone derivatives like haloperidol and others like pimozid and molidone. Atypical or newer generation like clozapine, olanzapine, risperidone, quetiapine, ziprasidone and aripiprazole. Now, mechanism of action. Dopamine receptor blocking action in the brain, where all antipsychotic drugs bind with the dopamine receptors present in the brain, and blocking of the D2 receptor present in the mesolimbic mesocortical region mainly responsible for antipsychotic activity. Serotonin receptor blocking activity includes that the newer typical agents appear to exert part of the unique action through inhibition of the serotonin receptors. Many of these agents also block the cholinergic, adrenergic and histamine receptor and cause various side effects. Now, pharmacological effects, antipsychotic effects. The antipsychotic drugs reduce psychosis by blocking the dopamine receptors mainly present in the mesocortical and mesolimbic pathway and 5-HT receptors in the brain and causes emotional quietening, psychomotor slowing, tend to decrease the thought disorder, paranoid ideation, anxiety, delusion, hallucination, decrease motor activity, hyperactivity, aggressiveness, and also have a calming effects and reduce spontaneous activity. They do not depress cognitive function and increase social interaction, decrease negative symptoms, mainly atypical drugs, also to a lesser degree typical drugs. The antipsychotic effects usually take several weeks, and these drugs also prevent acute attack and delay subsequent attack. Now, antiemetic effects. It stops vomiting by blocking D2 receptor of the CTZ of the medulla, an effect against drug-induced vomiting and not effective in motion sickness. Endocrine effects. For respiratory reproductive system, in male there is decreased libido and gynecomastia. For female, amenorrhea, galactorrhea, false pregnancy test, abnormal pigmentation, decreased corticotropin release, decreased growth hormone and ADH secretion, weight gain, increased appetite. In cardiovascular system, there is decreased PVR, decreased mean arterial pressure, orthostatic hypotension due to alpha blocking effects. Anticholinergic effects like M receptor blocking effect, dry mouth, blurred vision, sedation, confusion, constipation, and urinary retention. Other effects include alteration of the temperature regulatory mechanism, sedation, and weak diuretic effects. Pharmacokinetics includes high lipid solubility. These are readily but incompletely absorbed. Clinical uses include psychiatric indication include psychosis like schizophrenia, schizoaffective disorder, psychosis with mania, atypical psychosis, psychosis with depression, Tourette syndrome, and disturbed behavior in patients with Alzheimer's disease. And the prevention of the nausea and vomiting, persistent pruritus, intractable hiccup, and as neuroleptal anesthesia. Now, adverse effects includes most of them are the extension of the pharmacological effects, and few are allergic or idiosyncratic. Behavioral effects include pseudo-depression, and neurological effects includes Parkinson's syndrome like tremor, dystonia, akinesia due to extrapyramidal reaction, akathisia, and acute dystonia reaction, which includes spastic retrocolis and torticollis. Tardive dyskinesia may be seen, which is an important side effect, and Laird syndrome, which occurs due to relative cholinergic deficiency secondary to supersensitivity of dopamine receptors in coordinate putamen. The treatment is switching to a newer agent and avoiding all the drugs with the central anticholinergic activity. Seizure may be seen, which is very rare. Autonomic nervous system effects includes orthostatic hypotension and weight gain, hyperprolactinemia, hyperglycemia. Toxic or allergic reaction like agranulocytosis, cholestatic jaundice, or skin condition like pruritus, pigmentation, photosensitivity, and ocular complications like deposition in the anterior portion of the eye, increase in the normal process of the aging of the lens, and deposits in the retina causing browning of the vision. Cardiac toxicity like ventricular arrhythmia, conduction block, a neuroleptic malignant syndrome, which includes features like fever, muscle rigidity, altered BP pulse, increased creatine kinase isoenzyme. It is better to avoid in pregnancy, and it potentiates the action of the alcohol, barbiturates, narcotic analgesics, anticholinergics, anesthetics, and antihypertensive. The acute agitation due to odor of the alcohol may be potentiated by the chlorpromazine, Seizure disorders or epilepsy are the contraindicated conditions. Now, typical antipsychotics. These block 70 to 80% of the D2 receptors, alleviates many positive symptoms, and decreases motor activity. Atypical antipsychotics alleviate both positive and negative symptoms and block 40 to 60% of the D2 receptors and block 70 to 90% of the 5-HT receptors. The rate of the relapse is low and there are less pyramidal side effects. End of the topic.